Good afternoon, everyone, and thank you for joining. We wanted to take a moment today to reflect on the traumatic experiences of the past several months. Many in our community are feeling a combination of fear, anxiety, exhaustion, and exasperation. The COVID-19 pandemic has affected all of us, and it's taken a disproportionate toll on different communities here and around the world. We know that 5 members of our community have died from COVID-19, and many of us have lost loved ones, friends, and colleagues. We're also experiencing a tremendous amount of ugliness, motivated by anti-Blackness, misogyny, anti-Asian racism, xenophobia, hatred, and white supremacy. And national events are traumatic as well. We've suffered through mass shootings, killings of Black and brown people by those in law enforcement who have abandoned their responsibilities to their communities, and an insurrection at the US Capitol. And this week, we learned of the verdict in the murder of George Floyd, which followed a trial that was very intense and included a defense strategy that was extremely hurtful. Shortly, we'll invite each of you to spend time reflecting on the losses we've experienced as we'll observe a moment of silence together. But now I invite Provost Collins to say a few words.
Thank you all for joining us today. This year has challenged us to our cores. Lives lost, racial injustice, profound inequities, and so much more. The past months have impacted our global society, our country, our families, and each of us. From the foundational and fundamental to the seemingly small, what this year has taken from us and expected of us has been significant. This also reminds us that people make a difference by supporting one another and by working together to address our challenges. I believe that in coming together as a community to recognize both our shared and our individual traumas, challenges, and losses, we draw meaning, solace, and strength. Thank you. And I now invite Chief Diversity Officer Rob Sellers to share a few words.
Thank you. It's important for us to come together as a community, to take a moment today, to reflect, to think, to meditate, to pray, just simply to breathe as a community as we think about what we have lost as individuals, as well as a larger community. We're used to coming together and celebrating lots of really good things, whether it's in the Big House or Chrysler or Hill Auditorium or the Power Center. But if we truly are a community, it's also important for us to come together when times aren't so great. I recognize we're all tired, we're all weary, we're all hurting in different ways, that this has been the most challenging year plus that most of us have ever faced. And so we come together in this next moment to not only share our collective pain, but to also come together to rejuvenate, to become resilient, so that we can rededicate ourselves to doing the hard work to make the change that we all know and need to have. So please let us take this moment together in silence.
Thank you, everyone. We know that reflection can often generate very powerful emotions. So before we begin our regular briefing, we're going to take a brief pause for a minute or so. Everyone is, of course, welcome to stay in the webinar for the briefing, and we'll pick back up again after viewing some images from our community over the past year. Thank you. We have a lot to cover today, so we'll now go ahead and get started. Please note that live captioning and ASL translation are available and that a recording will be posted later this afternoon. Today we'll be going to around 2 p.m. and we'll get to as many questions as we can. And you can ask questions, of course, using the Q&A function. Today we're joined by Provost Susan Collins, Vice President for Student Life Martino Harmon, Chief Health Officer Preeti Malani, Rob Ernst, Chair of our Campus Health Response Committee, and Lorraine Washer, Associate Professor of Internal Medicine and Director of Infection Control at Michigan Medicine. We also have with us today 3 Associate Deans from our schools and colleges. Now, they'll discuss what students can expect regarding classes and other academic engagements on campus this fall. We get a lot of questions from students and parents about what classes will be in person. And our colleagues today can share some of the thinking that's informing their decisions about course modalities and other engagements. So joining us today will be Mark Clegg from the School of Music, Theater, and Dance, Tim McKay from our College of Literature, Science, and the Arts, and Marianne Mysek from our College of Engineering. We're also hearing many questions about vaccination and how it'll affect our plans for the fall. As of this week, all students and faculty and staff at the University of Michigan have been invited to schedule a vaccination by Michigan Medicine if they signed up through BlueQ. And we've offered multiple vaccination clinics in partnership with both Meyer and Kroger. In fact, right now, as we're conducting this briefing, there's a walk-up clinic, a vaccination clinic being held at the Big House until 4 o'clock today. It's open to anyone 16 and over with a Michigan Medicine medical record number. No appointments necessary for the clinic, and it's absolutely and completely free. We'll continue to provide convenient opportunities to be vaccinated in the days and weeks ahead. Please check the Campus Blueprint website for up-to-date info. Our plan for the fall semester includes students being able to safely attend in-person classes, co-curricular programs, social activities, performances, and athletic events. We want everyone to have a great Michigan experience next fall. Last week, I had the opportunity to participate in an online event with the great Yo-Yo Ma and many of our students. Yo-Yo engaged with students about the meaning of maps and boundaries in the setting of the pandemic. Art helps us see and understand our limits and our potential. While the online event was memorable, imagine us being able to do an event like that in person, involving direct student interaction and a live performance by the world's top cellist, his music inspiring us from up on the stage of Hill Auditorium. Many students would likely never forget such a moment. In order for our campus to fully recover from the effects of the pandemic, we need everyone who can be to be vaccinated. We'll talk today about vaccine safety. We'll talk about opportunities to be vaccinated and what the university will do to promote vaccination, allowing us to return for a more traditional semester in the fall. One step we're announcing today to assure a safe, healthy, and more in-person fall is making vaccination a requirement for students who choose to live in our Ann Arbor residence halls. We'll begin notifying students who've applied for housing, and Dr. Ernst and Vice President Harmon will share more of the details in a little bit. Last fall, there were over 600 cases of COVID-19 in the residence halls, despite rules around masking and distancing and major limitations on group activities. This winter, we housed far fewer students and everyone was in single rooms. If everyone's vaccinated, the residence halls can safely operate at near our normal capacity. Lounges and in-person dining will be open, and we'll be able to provide an outstanding residential experience for new and returning students. Please note, we're not requiring vaccination for everyone else at this time, but we strongly encourage everyone to get vaccinated. In the weeks ahead, we'll start to excuse vaccinated students from mandatory COVID-19 testing, and all those who are vaccinated will not have to undergo quarantine after a close exposure to someone who's infected, so long as they don't themselves have symptoms. We're considering a whole series of other incentives around vaccination as well. We're now at the stage where there's more supply than there is demand. It's now everybody who wants to be can be vaccinated. Let me turn it over to Dr. Milani.
Yeah, thank you, President Schlissel. And my message is short and simple today. In the interest of time, we'll hear more about the campus plans from Dr. Ernst and Vice President Harmon, and some specifics around vaccines from Dr. Washer. As we reflect on pain and loss, I also want to acknowledge the kindness and love that we've witnessed. And ultimately, that is what will move us forward. To the students, as you're wrapping up this year, I can't believe that how hard it's been. I'm so proud of you. Thank you for making this, the best that's possible during what has really been an imperfect year. I just want to add my own encouragement for vaccination. And once you've done so, please upload that information once you're fully vaccinated. The link is on the Mason Blueprint. We're starting to see those things come in. I know a lot of people have been vaccinated. It's also finals week. Some of you are waiting. Make the appointment, just make it for the end of the week, whenever you're done with finals, but please get vaccinated. There was a question that came up around insurance status. And I just want to clarify that you do not need to be insured to get vaccinated. And I know Dr. Ernst will talk to us about this. The team at the health service can help navigate the process to apply for Medicaid, and also has some other options that can be helpful for students, because being insured is really important beyond vaccination. And with that, I'm just going to pass it over. I know that Dr. Ernst will be joining us here.
Thank you, Preeti. I'll add my strong encouragement for everyone to seek vaccination. Right now, the state had seen a recent surge. Fortunately, that looks like we're getting into plateau status, and in the surrounding counties, cases are coming down a little bit. But we're at a point where the primary circulating strain of COVID is the B.1.1.7 variant. Fortunately, we believe and have good evidence to suggest that the vaccines are still effective against that variant. And what we're finding is that variant, which is more transmissible, is finding unvaccinated people. So the benefits of vaccine far, far outweigh the possible downsides to a vaccine from a medical standpoint. There are very few, if any, real medical contraindications to getting vaccinated. And I'm worried about some of the myths that we're hearing from folks, one of them being the insurance barrier that some people report. Healthcare providers and pharmacies are able to bill insurance for an injection fee, but that is in no way able to prevent them from giving the vaccine to people without insurance. So there should be no out-of-pocket expenses and no barrier for people from a cost standpoint to get the vaccine. We're hearing some other myths about the vaccine as well. One of the real troubling ones we're hearing about is some people feeling like there's a risk for fertility in young women, and there's no evidence to support that either. So we're really pushing hard on the benefits of vaccine to the individual as well as to the community. And I think one of the great strengths of Michigan is both a graduate and a parent is the sense of community. And we've heard it time and time again, that it's so great to be a Michigan Wolverine, and that speaks to the sense of community. And I think there's a real commitment to others that you can provide. And we just don't know the long-term complications of COVID. You know, that's an uncertainty, even if you've had a mild case up front. So there's personal benefits, there's benefits to the community. I'm a very strong supporter of this.
You know, Rob, I just want to make one plug for the team at UHS. I do this often, but, you know, talking about extended symptoms from COVID, the team there, in fact, earlier today, they gave a presentation at Internal Medicine Grand Rounds. They're working really hard to try to support the students who do have lingering effects. They're trying to learn. And one of the things we're learning is that vaccination may be mitigating some of those effects. We're learning more as we go, but plug for UHS, plug for all the resources they have, and of course, a plug for vaccination.
Yeah, and Rob, before we hand things off to Vice President Harmon, tell us your thoughts around the residence hall vaccination policy that I just announced.
Well, it is true that, you know, unfortunately in the fall, we did have clusters of cases in the residence halls, you know, when we have a lot of people living in close proximity to one another that put others at risk. That's again, speaks to the dual benefit of personal protection as well as protection to the community by getting vaccinated. So I'm strongly supportive of this. We've seen already the benefits of vaccinating congregate living areas like in local nursing homes. It's been a really early success story of vaccination in the community to see how it has altered the course. It's been a terrible story for those settings early in the pandemic. And yet now we're seeing real benefit due to vaccination. So I do believe it's a key way of, so by requiring those who choose to live in the residence halls, I think that we're able to provide that really experience that many missed this past year. So I'm a strong supporter of that.
Thanks very much, Preeti and Rob. Let me turn it over now to Vice President Harmon.
Thank you, President Shaliso, and welcome everyone. I want to apologize for my scratchy voice. I'm dealing with some allergies. But today I want to talk a little more about the announcement regarding the vaccine requirement for those who choose to live in university housing. This has been a top of mind question for many students, families, staff, and faculty. In fact, just last week, I was at Palmer Field with Rec Sports to hand out free water and Gatorade to students who were playing tennis, basketball, and other games. And many of the students I chatted with wanted to know, are we going to need a COVID vaccine for the fall? When I asked them what answer they were hoping for, they told me they thought that vaccines should be available for everyone on campus. While that was an informal interaction with random students last week, we've also proactively sought extensive feedback on this topic by engaging in conversations with student leaders, student groups, and other stakeholders across the university for a few weeks. Overall, the responses showed a strong interest in students being vaccinated. So here are a little more details. As President Shaliso announced a moment ago, the COVID-19 vaccination will be required for students who choose to live in UM housing beginning in fall of 2021. As we have discussed in the previous briefings, we all know that getting vaccinated against COVID-19 will play an important role in enabling for a more normal and engaging residential fall and helping students confidently and safely take part in all aspects of residence life. In addition to being highly effective in protecting against serious COVID infection, a vaccination will exempt students living in UM housing from mandatory testing and will allow for the opening of residential lounges and study spaces, something that students have missed this past year. We also know that those spaces can help build community and they provide opportunities for developing new and existing friendships with your peers, as well as providing for space for studying and relaxing. If you're not planning to live in UM housing this fall, you may be wondering if you're required to get vaccinated. President Shaliso addressed that. At this point in time, we're only requiring this for students who choose to live in UM housing, but we strongly encourage you to get your shot. Every shot counts. You're going to hear that a lot today. We've also really encouraged students living off campus in other congregate living environments like shared housing, or students planning to attend large gatherings of friends to get vaccinated. Every shot contributes to the effort to bring a more normal Michigan experience back to us in the fall. Information about the overall University of Michigan approach to vaccination and links for finding vaccination locations near you can be found on the Maize and Blueprint website. Students are able to easily report their vaccination status through the links on that page, as Dr. Malani mentioned. We strongly encourage you to report your vaccination status as soon as you complete your shots, because this will help us determine what sorts of activities we can safely plan for as part of the fall experience. For students planning to live in UM housing, you will need to report your vaccination information by July 16th, 2021 at 5 p.m. Eastern. Please contact Michigan Housing if you have any questions or if you're unable to meet this deadline for any reason. Many students have already seized the opportunity to get vaccinated via special clinics offered on or near campus this past week. We've also seen a good response from students uploading their vaccination status as having completed their second shot. Thank you for doing your part to take care of the Maize and Blue. I want to also compliment CSG because they arrange buses to take students to get their shots. Shout out to everyone for making this happen. I got my own second dose just this past week, and I'm doing great. And finally, I want to say to students who are completing their exams and their projects to do a great job and please enjoy your summer. And now I'll turn things back over to Dr. Malani.
Let me step in for 1 second in the way there. A number of people have already asked about these really cool backgrounds that we're all sharing today. Don't miss your shot. They'll be available up on the Maize and Blue website later today for those who have asked, can I get a background like Tim McKay's background? You know, don't be jealous. You just go ahead and download it. So we'll get it to you today. And I'm actually going to turn things over next to a special guest, Dr. Lorraine Washer. Lorraine's an associate professor of internal medicine and director of infection control for our entire health system. And she's been doing a lot of heavy lifting, help us manage the pandemic on the campus. So thanks very much for joining us, Lorraine.
Great. Thank you so much, Dr. Schlissel. I hope that you can hear me.
Yep.
So great. Thank you. All of us know that the toll of the pandemic to this point has been tremendous. And in fact, it includes over now 144 million cases, 3 million deaths globally. And in the United States, nearly 32 million cases and more than 570,000 deaths in the United States. To put this into perspective, this equates to more than the number of Americans who died in World War II. And it's nearing the 675,000 US citizens who died in the 1918 influenza pandemic. And each of these deaths represents a personal story and a personal loss that will last even after the pandemic abates. And while many areas in the United States have shown slowing or declining cases of COVID, the cases in Michigan had been rising very rapidly. And in fact, we've had more than 800,000 cases and 17,000 deaths just in the state of Michigan. And we have entered and are in the middle of an alarming third wave of COVID in Michigan, leading the United States with the most COVID cases and the highest COVID case rates. These increases are being driven probably by relaxing of behaviors around public health measures, such as social distancing and mask wearing, as well as the high prevalence of a more easily transmittable B117 COVID variant. And the high number of residents in Michigan who have had not either previous COVID infection or been vaccinated. With this wave, we're seeing changes in case demographics. Those ages 10 to 19 now have the highest case rates. These are school-aged kids. And these case rates are followed by those who are aged 20 to 50 years old. The lowest impact we're seeing now are now in the older ages, reflecting the enormous positive impact of vaccination among the vaccinated older age group. While the increases in COVID that we've seen in Michigan are difficult for all of us who are weary of the pandemic, there's really great reason to be optimistic. There have been over 6 million COVID vaccine doses administered in the state of Michigan, and 45% of all Michigan residents 16 and older have had at least one dose of vaccine, and 35% have completed their vaccination series. As mentioned, we now have broad and increasing access for all adults and 16 and 17-year-olds as well. But we're in danger of falling short of getting to a level of vaccination coverage needed to achieve the goal of community immunity that's really required to beat the virus. And to achieve this goal, we need to assure that we have vaccine access for everyone and understand some reasons for vaccine hesitancy among some of us. We know that hesitancy may be related to concerns about personal risk, vaccine efficacy, vaccine safety, or mistrust of the vaccine or healthcare in general. And really, it's our duty, our obligation, and our need to turn this vaccine hesitancy into vaccine confidence. And there really are very many good reasons to be confident in the COVID vaccines. First, as mentioned, they're very effective. 94 to 95% efficacy in clinical trials at preventing symptomatic disease. And that's being confirmed with our real world data and our experience now with greater than 90% effectiveness in the real world, including against the now predominant B117 variant. A primary goal of vaccination is to prevent hospitalization and death, and the vaccines are doing just that. Out of the hundreds of people hospitalized for COVID at Michigan Medicine over the last months, we have seen only just a very few fully vaccinated people who've required hospitalization. Those that we are seeing who are requiring hospitalization for serious COVID infection haven't been vaccinated. However, as a result of the high number of people with COVID infection in the community, we do expect to see, and we are seeing, some breakthrough cases. And these cases are being carefully tracked, but they represent only a very small fraction of cases. And when we see them, they're currently largely asymptomatic or mild. There's also growing data that vaccination prevents asymptomatic infection. And this means that the vaccines that you get will protect not only you, but they'll protect your family and others that you're around. Secondly, the vaccines are not only effective, they're safe. They've been given to millions of people. They're undergoing intense vaccine safety monitoring. The clinical trials have included a diverse population, including Black and Hispanic participants, older patients, people with underlying conditions. The mRNA vaccines made by Pfizer and Moderna do have frequent short-term side effects, muscle soreness, headache, fever in many, but not all recipients. But no lasting safety concerns have been seen. As you likely know, this robust vaccine safety monitoring process has detected very rare cases of cerebral venous sinus thrombosis that have been associated with low platelets that have occurred within 2 weeks after the receipt of the Johnson & Johnson COVID vaccine. This equates to about a 1 in 1 million vaccine dose risk. And this has resulted in the pause of the use of the J&J vaccine in the United States. But it's this very robust vaccine safety monitoring process that has allowed us to see this signal, and to step back and make important decisions around revised recommendations about the safe use of the J&J vaccine. And we actually expect to hear updated recommendations today from the FDA and the CDC around this. But even with highly safe and highly effective vaccines, some individuals may not yet have vaccine confidence. Some people may have previous experiences that affect their trust and confidence in the health system. And in order to gain vaccine confidence, we need to acknowledge that there is a critical role of building trust. Trust in medical professionals, trust in public health professionals, trust in community leaders. And we can all help by listening to those who are making a choice not to get vaccinated, building relationships to understand their motivation, their fears, or other concerns. Strong confidence in the vaccines within communities leads to more people getting vaccinated, which leads to our shared goal of fewer COVID illnesses, hospitalizations, and death. Thank you.
Thanks very much, Dr. Washer. I just read today, for example, around safety, that a study was done, and There's no different risk if you're pregnant getting vaccinated at the same time. That data just came out. This is really the most intensively studied vaccine in history, and it's been administered to over 100 million people. So even very infrequent side effects would be detected. So I really, can't encourage everybody even more strongly. There are major organizations around the country now that have begun to require this. We just read yesterday that the University of California, where I used to work, and Cal State University System, representing well over 1 million people, have required all of their students and faculty and staff to be vaccinated. The University of Maryland was announcing a requirement, Rutgers University. So, many major institutions are recognized the importance of very high levels of vaccination in a community to get back to safe and normal life. And I bet you that our community can exceed everyone's expectations in terms of getting vaccinated. The students I've spoken to informally, when I make the rounds of campus, or I attended the Big House photo shoot the other day, either people have been vaccinated or they have their plan to be vaccinated. Let me ask though, it's very important that people enter their vaccination status, that students enter their vaccination status online, whether they got vaccinated here by us or whether they drove to Ohio or up to Traverse City, doesn't matter. So everyone, all students can enter their vaccine status through this online portal. It's very easy, along with a picture of your vaccination card. Let me now turn things over to Provost Collins.
Great. Thank you, President Schlissel. And let me add my request, strongly encouraging everyone to be vaccinated, have a plan, don't miss your shot. I really wanted to start out by just congratulating each of our students, our faculty, and our staff for reaching the end of the semester, this very difficult term. Most of our programs now have held their last classes, and we really are in the final stretch. So to our students, we are so proud of your determination, your resourcefulness, and your hard work. Hang in there, and all of the best for your final exams and your final papers and projects. You're almost there. To our faculty and our staff, a heartfelt thank you for all that you have done throughout this difficult semester and for your continued efforts as we plan for the terms ahead. And last but absolutely not least, to our graduates, congratulations. We look forward to celebrating this milestone and all of your accomplishments. And I believe that there are some questions for me.
I think, Susan, you were going to introduce our Associate Deans here with us today.
Yes, my apologies that I had the order a little bit wrong. And so as we look towards the fall semester, and we're so excited about moving to an experience that will have so much more in-person activity for our students in particular. We've received many questions about what students can expect, and we'd like to find as many ways as possible to address those questions that we're hearing. But of course, with so many different types of programs and student experiences across campus, from our undergraduates to our graduate and professional students across 19 schools and colleges, there's no simple answer to many of the things that people would like to know. And so for today's briefing, we've invited associate deans from 3 academic units to provide you with additional information, which we hope you'll find informative. And so I am delighted to welcome each of them to our Friday briefing to share some information with you. And so we'll go in the order that we have listed here on the slide. First, Mark Clegg, Associate Dean for Undergraduate Academic Affairs at the School of Music, Theater, and Dance. And then Tim McKay, Associate Dean for Undergraduate Education in LS&A. And then Mary Ann Misek, Associate Dean for Graduate and Professional Education at the College of Education. And so Associate Dean Clegg, please.
Thank you so much, Susan. It's great to see everybody today, and thanks for the opportunity to talk to you. We're really excited about the upcoming year. For the past 14 months, I mean, it's been a transformative time really for the whole campus and the world, but certainly for the performing arts. We've developed a lot of innovative and effective techniques for presenting music, theater, and dance online in the last year, but this is not what we got involved in the arts to do. We are deeply committed at the School of Music, Theater, and Dance to prioritizing in-person instruction for the 2021-22 academic year and beyond. In fact, by following a really carefully articulated plan that was put together by our staff and faculty and developed in partnership with the university's Environmental Health and Safety Department, SMTD has actually been holding in-person classes throughout the year, both in fall 2020 and the most recently completed winter term. We've been doing academic classes online, but we've been doing a lot of our performance activities, with careful safety protocols in person. Our community has really come together. The students, faculty, staff have all been great. Compliance has been great. And in fact, to date, we've had no documented cases of transmission of COVID-19 and associated with any of our in-person activities, our classes, our labs, research, or performances. And we hope to build on this success in the coming year. I mean, certainly there have been challenges, but I've simply been blown away by the creativity of our students, faculty, and staff who have adapted creatively to teaching in a socially distanced environment and learning successfully in this environment. And students are growing, they're doing amazing things. A fantastic example of this actually just happened last weekend, where we presented our 44th annual collage concert, which is one of the highlights of our year, online. It traditionally features performances by every single department at the School of Music, Theater, and Dance, includes more than half of our 1,100 students as dancers, musicians, and actors, typically performing for more than 2,500 people in Hill Auditorium. And it's an amazing experience just to see the variety and talent of our students. This year, our collage concert was entirely virtual, but no less spectacular. And the online premiere streamed last Sunday for about 1,000 people. And we've had 7,000 views already. I'm going to take the liberty of dropping this in the chat for you. So if you want to watch it on your own time later, I highly encourage you. It's just inspiring to me just to see what our students have pulled off. You can also find it on YouTube for the next 12 months just by searching Michigan Virtual Collage Concert 2021. So there you go. For the coming year, we're going to continue to prioritize our educational and creative mission. Few courses will certainly be online to reduce some of the pressure on our spaces, but the vast majority of our activities are planned for fully in-person instruction. We're going to update our safety protocols with new guidelines as things develop over the summer, but we see the fall semester as a transition back to a new normal. Our faculty and students really cherish the opportunity to work collaboratively in situations that make face-to-face, human-to-human connections possible, and these lie at the heart of artistic creation, our disciplines. Our actors need to see each other's eyes. Our musicians need to hear each other in three-dimensional sound. Our dancers want to partner and swing each other around the stage in their choreographies. And we really hope to have the energy and excitement of live audiences as soon as possible. But we are certainly going to be working together with our students in person this fall. We've developed a lot of tools and we're excited about the new online possibilities, but the modalities of artistic performance that really emphasize collaboration and in-person work will continue to be important in the future and will remain an essential part of what we do at the School of Music, Theater, and Dance and in the arts that we cherish. Thank you so much.
Thank you. Associate Dean Tim McKay from LS&A.
Great. It's wonderful to hear you speak about the collage concert. Mark, it was a really great event. It's always a great event in person, but this year online, it was a very special one. So I would encourage everyone who's in the audience to look that up as an example of the resilience of Michigan students during this year. I want to start by reiterating the most important point. Vaccination is the key. If the vast majority of us are vaccinated by fall, everything we do will be so much easier. As President Schlissel has said, fall 2021 will feel like a transition to a normal semester in winter 2022. Fall won't be completely normal, and we need to be prepared for some continued public health constraints on density and the possible need to do teaching and learning while masked. This reality that fall is a transition period is shaping our planning in the College of Literature, Science, and the Arts. During the whole coming year, we want to explore how to combine our long-standing commitment to residential learning with some lessons that have been learned during the COVID crisis, especially lessons about accessibility and inclusion and student success. Our goal together as a community is to collectively reimagine undergraduate education for LS&A's third century. And let me just remind everyone that while I'm speaking for LS&A, Courses and Student Services in LS&A support students from all of the undergraduate schools and colleges of Michigan. These LS&A experiences are often at the heart of a Michigan experience. Okay, so let me talk first about classes. In the fall of 2021, more than 85% of LS&A's 4,000 plus courses will meet fully in person, very much as they always have. They will be in slightly larger rooms. We may be wearing masks during the fall, but we will be meeting in person. Of the remainder of those classes, the last 15%, most of those even will be what we call blended courses. What I mean by that is that in a blended course, some course meetings, maybe one of the hours a week, take place fully in person, while others take place fully online. So those courses will still have substantial in-person elements, but do some other things online. Let me give two examples of this. First of all, courses that have very large lecture meetings and small discussion sections may deliver their lectures online and then meet their small discussions in person. Another example is provided by some of our language courses. It turns out that doing all of language instruction while wearing a mask is very difficult. And so some of our language courses will be combining 2 fully in-person meetings a week with 2 fully online meetings that enable people to take off the masks and speak to one another more directly. So these are both examples of blended courses, and you'll be able to see these structures in the LS&A course guide, which will list some meetings as in-person and some meetings as online. It's only a very small fraction of our classes that will be fully online in the fall. And many of those are what we call mini courses, 1 or 2 credit courses, which usually meet for half the semester. During the past year, both students and instructors told us that they thought these courses worked well online, and that they allowed students to add something that was both flexible and accessible, but still substantive to their otherwise busy schedules. So we're exploring the idea of using online mini courses as part of our long-term planning, and as part of this experiment, we'll have some of these this fall. Now, I want to make one proviso. While we're very enthusiastic about returning to in-person classes, we're also aware that some students, especially international students, may not be able to return to campus for the beginning of the fall term. While we will not be offering our full curriculum to remote students in the fall, we are committed to creating online learning opportunities that will allow students who cannot get to campus to continue to advance their degrees. Right now, we're monitoring this situation very closely, and we will continue to do so throughout the summer. We plan to release some more information about how we will accommodate students who cannot get back to the country, for example, during the second half of May. It won't be a complete suite of course offerings, but we do believe we'll be able to offer things that will enable people to continue their educations. Looking beyond course offerings, we're especially excited to return to in-person support of students outside of class. And here too, we will be exploring how to enhance essential in-person services with accessible and effective online support. So we're very excited to have undergraduate researchers back in our libraries and labs with their faculty mentors and their graduate student teams. But these students will also be able to do things like attend remote conferences from here on campus, something they weren't able to do before. Our student support services, like the Science Learning Center with its study groups and tutoring, the Sweetland Writing Center with its writing consultations, and all of our academic advising of all kinds, we will return to in-person services with all those things. But we will also make them available in online formats in ways that make them more accessible, convenient, and effective for students. Part of the experiments that we're doing. The students in our Michigan learning communities will again be living and learning together. We're super excited about that. They'll be building the kind of relationships that will sustain them both through college and throughout their lives. But they will also be able to do things they weren't able to do before, like visit with alumni all around the world through online meetings. So we're mixing what we have always valued as in-person interaction with what we've learned to do online. By winter 2022, we expect that public health constraints will be further loosened, and we'll continue to work with our students and faculty and staff to reimagine the residential liberal arts education of the future, combining all the virtues of traditional face-to-face social and intellectual community with some of the accessibility advantages of remote connection. So to conclude, I just want to say that as we emerge from this difficult and really often tragic COVID year, we have many things to remember and some to mourn. but we also have a lot to look forward to. This is a tremendously exciting time to be in higher education as a student, as a staff member, as a faculty member, while it's being reimagined. And if you're going to reimagine the future of education, there's no better place than the University of Michigan to do it, because we will be a central part of creating this future. Thanks for giving me a chance to give you this update, and I will pass it on now to Marianne.
Right. I first just wanted to say, of course, Associate Dean from the College of Engineering. And so Associate Dean Misek, please.
Great. Thank you very much, Provost Collins. So Michigan Engineering's goal for the fall is to support each and every member of our community as they pursue their educational and professional goals. In particular, we recognize that in-person engagement is an important part of the engineering student experience. And so this is what we have emphasized for the fall, for education, for research, and for co-curricular activities. In general, we expect that Michigan Engineering will return largely to in-person activities during the fall term. Naturally, we're contingency planning so that we have the flexibility to adjust should the need arise. Our priority is to safely maintain the continuity of education, research, and academic progress for all students, with health and wellness at the forefront. And to assist with this, our staff and faculty will be present on campus to support student needs. Now, students who are currently living outside of Ann Arbor sometimes ask us whether they should make plans to move back to Ann Arbor in the fall. And the answer is absolutely yes. The on-campus experience this fall, classes, research, and student life will be rich and vibrant. And so we strongly encourage our students to do everything they can to return to campus for the fall term. All students, undergraduate and graduate, will benefit from the residential experience on campus. We expect that in-person student activities will be much like they were before COVID, but with social distancing, depending on the latest guidelines. For example, we're working with Student Life to maximize the Welcome Week experience on North Campus. We're planning a hybrid graduate student orientation on campus. And for career fairs, we're giving companies on-campus opportunities to interact with our students while also offering virtual formats to meet the needs of some employers. On the academic side, engineering classes will largely be in person this fall. Decisions about course formats, design, and pedagogy are student-centered. They're focused on creating equitable, inclusive, accessible, and effective learning environments for all. Undergraduate engineering courses will be focused on in-person instruction modes to maintain their interactive, engaging, and hands-on character. The expectation is that undergraduate students will attend their engineering classes in person with limited exceptions. Now, some of our graduate and professional students, particularly international students who may face travel restrictions or visa delays, have asked us what kind of distance learning options will be available to them to begin or continue their studies with us in the fall. In engineering, our graduate and professional courses will also be largely in person, but with greater flexibility. Our graduate programs will determine whether individual sections of their courses will operate fully in person, hybrid, or distance. In addition, we expect that some graduate courses will be offered in a blended format where some students may sign up for an in-person section while others sign up for a hybrid or distance section. As you can see, we have engineering courses planned across multiple delivery modes, so all of our students can maintain educational progress without compromising rigor and learning. Now, we recognize that in-person engagement is a critical part of the research experience as well. Currently, all Michigan engineering research facilities are open, and we expect that widespread vaccination and continued vigilance will allow us to maintain a safe research environment. And we're working hard to make sure we can continue to engage in in-person research during the fall. So in conclusion, we know that this has been an unpredictable year, and we recognize that it may remain unpredictable for some time. But if we've learned anything from the past year, we've learned that by working together as a community, we can solve any challenges that may arise. And that's why we're asking the entire College of Engineering community, our faculty, staff, and students, to join us in creating our new normal for the coming year. Our return to largely in-person instruction this fall is an opportunity to optimize what we've learned during the pandemic and emerge stronger. We're very much looking forward to welcoming our students, faculty, and staff back to campus this fall. Thank you.
Thank you all very much. You know, I'm amazed at the tremendous amount of work that underlies this shift back into a curriculum that does some degree of accommodation, but is now largely an in-person curriculum. So please extend, you know, my thanks to all the faculty and your colleagues that have been involved in this heavy lift, also on behalf of our students. So I'll now turn things over to Dr. Milani to grade our questions and answers.
Yeah, thank you. And I know we don't have a lot of time, but we will do our best to get through as many of these as possible. And then we'll try to answer the rest as usual. So the first question, and Martino, I'm going to tee this one up for you. I'm an international student and I'm worried I won't be able to get an approved vaccine in time for moving into U of M housing this fall. Can I get an exemption from the vaccine requirement?
The answer is yes, but we also anticipate there'll be opportunities for students to receive a shot when they arrive in the fall. And there may be obviously a period of time where they have to take extra safety measures until they complete their shot regimen. But if a student is unable to receive vaccine based on their situation and where they live, then they can apply for an exemption and still, again, work toward getting a shot. We know that there'll be situations where some students will request an exemption. Documented exemptions will be reviewed and accommodated if approved. Request forms will become available in mid-May, and those approved for exemptions will have to participate in mandatory testing and certainly take other safety measures. So we're only able to accommodate a limited number of exemptions, but so I would just encourage all students, if at all possible, to not miss your shot, and when it becomes available, to definitely take it.
Yeah, thank you. And I know there are going to be questions, particularly from international students. And you know, just to reiterate, like our goal is not to make this a burden or a barrier. We want to make this helpful and a safety measure. And we're going to do everything we can on this end to make sure you can get what you need if you can't get it in your home. Next question, and I'm going to give this one to either Dr. Ernst or Dr. Washer or both. Can you please discuss the relative risks of COVID-19 versus the vaccine for young people? This is a question that comes up a lot.
Yeah, I think I'll just start, and I think Rob may have more to add. You know, I think this gets about the motivation for vaccination, and certainly there's personal safety motivation, and there's public health safety motivation for vaccination. All of the vaccines that are available in the United States are very safe. I think that the mRNA vaccines in particular have not been associated with any long-term complications or serious complications. And as far as when we talk about the risks of the vaccine in that setting, certainly the benefits outweigh those risks. The benefits to young people may not be immediately evident, but young people with seemingly minor medical problems like asthma or potentially being overweight can certainly put even young people at risk to have severe disease. And so for the most part, the benefits of the vaccine far outweigh the risks even in young people. I think we'll be getting some more guidance around the J&J vaccine and this very rare cerebrovascular thrombosis that occurs that may be more likely to occur in young people. Even so, that risk is very, very low. And depending upon what the FDA and others say, it may still be an option for young people. But again, that one I think would require a little bit more discussion. And if there was concern about that risk, there's certainly other options available.
Yeah, thank you. And one thing that we always point out is that it's not just your risk as young people. And of course, Lorraine, you and I in our work in infectious disease are seeing young people hospitalized, but it's also protecting everyone in your community, including parents, grandparents, others. I'm going to move on. How is the university planning for a return to a more in-person work following the extension of the MIOSHA order until October 14th? And I'll ask Provost Collins to please comment on that.
Yes, of course. So as people may be aware, the current MIOSHA rule does say that the employer shall create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So the order certainly does not prohibit all in-person work. And in particular, delivering a residential experience requires an ecosystem of activity across campus, both inside and outside of the classroom, by faculty, staff, researchers, and others. So as we look forward to and prepare for a more residential fall, our faculty and staff will gradually begin to return to on-campus work. And what can feasibly be done remotely is going to change over time as we approach the fall semester. I do want to reiterate, though, that as units plan for a phased and gradual return to on-campus work for more of our employees, units will provide plenty of advance notice because we recognize the need for family planning and other types of planning in this context.
Great, thank you. And I'm going to give you the next one too, and maybe we can answer it quickly. This is about the status of the study abroad programs. Can you update us?
Sure. So non-essential university travel does remain suspended, and the university is taking quite a cautious approach to offering study abroad and other international opportunities in that context. We certainly are committed to the value of that engaged learning international experience. And so schools and colleges are able to determine which types of international students' travel experiences, including research and study abroad, are essential. And so they have flexibility to allow students to pursue essential research internships and study abroad opportunities in other settings and cultures. The Provost's office has a set of procedures and requirements that mitigate travel and COVID-specific risks. And only U of M study abroad offices that meet those requirements can offer undergraduate study abroad programs at this time. So there's more information about that. You can contact your unit study abroad office. Please remain flexible and understand that things are moving forward gradually. And you can visit the U of M Campus Blueprint Travel FAQ section and the COVID-19 Travel FAQ on Global Michigan for more information.
Thank you. And a quick follow-up for Martino, and then we'll end the questions for today. Martino, will move-in for the fall be staggered, and will a parent need to be vaccinated to help with their student move-in?
Yeah, so just as we implemented this winter rather, move-in will be scheduled, and so students and families will have to pick a specific time. That allows us to spread the move-in process out so there won't be bottlenecks. We certainly strongly encourage all family members to be vaccinated, but we're not requiring that. It's really a challenge to mandate, enforce, and track vaccinations. However, we will, as we have done in the past, mandate masking as well as some level of social distancing. So we'll keep the environment safe.
Thank you. And I'll turn it back over to President Schlissel to close us out.
Great. Look, thank you all very much. A lot of information today. Also a very moving period of reflection that we shared together in the beginning of the hour, and hopefully will continue around the campus in the weeks and months ahead. Best of luck to all our students with their finals, and also my congratulations for finishing up a really challenging academic year, and I urge them to finish strong. Congratulations to our students who will be graduating. I'll be watching the online graduation ceremony from the Big House along with the provost and a few others next weekend. So that's something exciting to look forward to. For those of you that are worried about issues of who's going to be required to be vaccinated, this is entirely within your own control. If you are nervous about COVID-19, if you're concerned about coming back to work, if you're worried about risks in the classroom, get vaccinated. That's the answer to each of these problems. Our classrooms were actually quite safe last academic year, despite the absence of vaccines. They'll be safe this year, but if you want to protect yourself, it's a personal responsibility to go out there and get vaccinated. And now there's way more vaccine than there are people queuing up. So the time is now. It's never been more convenient. So thank you all very, very much. Be safe. Have a wonderful weekend, and go blue.